Hello, everyone, and welcome to week 2 of our mini course on the history of health and medicine in late 19th and early 20th century Britain as part of the University of the Third Age Shared Learning Project on 1901 postal pensioners. And this week, the theme is understanding ill health and death in 19th and 20th century Britain. I struggled for a while to try and think of an appropriate title for this week. I'm not entirely happy with this one because really across the whole of the 4 weeks, what I'm hoping is, we're going to look at ill health and death in 19th and 20th century Britain. But I'll just sort of cover briefly now what we're going to go through this week. So the big aim for this week is to get you all to better understand mortality changes in the 19th and early 20th centuries. As the subsequent slides are going to show, this was a really important moment of demographic change and change in the overall health of the populace. And actually having 1901 as our focus is actually really interesting in this regard. And so first we're going to concentrate on like some big picture stuff. So looking at these very broad changes in mortality and life expectancy and so on. So that's kind of everything's on a grand scale there. Whereas in the second part of the lecture, I want to sort of the scale is going to get a bit smaller, and I want us to think about how illness might have affected your pensioners' everyday life, both at home and at work, and the options that were open to them. This doesn't mean that we're not going to be looking at home and the workplace the next few weeks, particularly the week on treatment, for example. There's going to be focus on, how people treated illness at home. But it's just to kind of get you guys thinking really about how periods of illness or death affected the family unit as a whole, particularly economically. And then also changes that ensued that provided more protection for people at work, particularly when they were injured on the job. Part 1, we're going to go through some of this big picture stuff. We're going to be looking at mortality patterns. And I have to have a disclaimer here. There is still a lot of uncertainty and debate amongst historians about sickness rates, which are actually a lot stickier and harder to look at, but particularly about mortality patterns in the past. There's reams and reams of research on this, of historians trying to decipher exactly why there was a mortality decline, and particularly why the causes of mortality changes, so the reasons why people dying, why that changed. So I'm in no way an expert in this particular area, and so I'm going to be doing some broad strokes here. But I will recommend in the syllabus some additional reading if people are interested. And obviously on the Addressing Health project, we have people who look a lot at this area. So, if you have any particular questions, feel free to email me, and I can forward any inquiries. And the second point here is really to discuss why there's a lot of debate, particularly amongst why mortality changed in this period. So why people were dying, particularly because we have to provide as historians lots of room for error about causes of death. So, for example, when a cause of death was just old age, nowadays we would not see that as a sufficient or satisfactory answer to why someone was had died. We'd see conditions and diseases associated with old age, but we wouldn't use it as a sort of catch-all umbrella term. For 1901, the causes of death tend to be slightly more specific. Old age or things like fever, for example, are slightly older terms that were used earlier on in the 19th century. But again, just to hint here about why there's been so much controversy over mortality change in this period, it's because the sources we work with are far from perfect. And I want to start by thinking about the popular image of health in the 19th and early 20th century. This show is a newspaper cartoon of French soldiers being slaughtered by the war in the Balkans through an outbreak of cholera. And I chose it because it's a very dramatic picture, and I think it encapsulates a lot of what we think of health being like in the 19th and 20th centuries, which is we overwhelmingly think of infectious disease, and we think of it always as this cataclysmic event, this, this harbinger of inevitable death that people were helpless to do anything about. And I think hopefully in this lecture I'm going to show why that is perhaps not the whole picture. So to begin with, we have to think more about infectious disease in the 19th and early 20th centuries, what it was, the lived experience of it. So infectious disease in the 19th century, you have a mixture of epidemic events, so cholera outbreaks, smallpox, the Russian flu, for example. And on the other hand, what we really get is we get these kind of more local histories of disease with recurring endemic infectious diseases. And these were particularly marked amongst the young with diseases like measles, whooping cough, scarlet fever, but also things like botulism outbreaks were quite common. And one of the things we're going to do later on, one of the tasks for this week is to think about local histories of health and including infectious disease, and think about, whilst there might have been these apocalyptic style events of, cholera outbreaks or smallpox outbreaks, or even plague outbreaks, for example, in Glasgow in I think 1901, I might be wrong, there was a outbreak of plague, for example. So while these are, dramatic events, we have to think about, the smaller scale outbreaks that were often very closely tied with the seasons. So, you got around the start of the school term, you would get spikes of scarlet fever, for example. And now I want to talk about changing mortality patterns. So I've got some lovely figures here and a nice looking table. So as you can see here straight away, the biggest mortality change in this period, and the one that historians are endlessly debating about, is the decline of people dying from infectious disease, and with that, the increase of the number of people dying from non-infectious or non-communicable diseases, so diseases like cancer, diabetes, heart disease, and so forth. So this table here from an article here kind of illustrates this quite nicely, that, as the mortality rates from infectious disease decrease, the people who are dying of degenerative or chronic diseases increases, so that by 1910, so 9 years after your pensioners retired, only 10% of deaths were due to communicable diseases, versus around a third to 40% from 1848 to 1872. And by 1914, the major infectious diseases like TB or cholera have been replaced by cancer, heart disease, and diabetes as leading causes of poor health and death. And why was this? So one of the things is that with rising life expectancy, as people are surviving infectious diseases, then as they're getting older, they're becoming more and more prone to diseases commonly associated with aging or lifestyle choices. So that's why you get the increase in conditions like heart disease, diabetes, etc. And so what we see is about the time your pensioners retired, so this is for England and Wales, we do see quite a sharp increase in life expectancy, and I'll go on in a little bit to explain why the factors behind this that historians have posited. And what we see as well is, I've put this here in 1908, the introduction of the Old Age Pensions Act, and this was across England, Wales, Scotland, and Ireland. This introduced a small allowance for people over the age of 60, because there was an increased awareness that in this time that the elderly poor were not particularly, from a Victorian standpoint and Edwardian standpoint, I should say, they were not to blame for their condition. They weren't like the thriftless drunks. This was an inevitable consequence of being human, and so the state needs to make some provision for them, because it was kind of seen as cruel and inhumane. And obviously, as a result of that, obviously not the only reason, but the introduction of state benefits for the elderly then is obviously helping to increase the life expectancy further as well. And just to say, for Ireland, the island of Ireland, we see a very similar thing, perhaps not so steep, but we see a very similar trend to the one we see in England and Wales. Unfortunately, I can't find an equivalent graph for Scotland, so apologies for that. But reading around the subject, from what I can gather, the trend was fairly similar to what we see in England, Ireland, and Wales. Even though there's much more recent interesting history about life expectancy in Scotland, but I won't go into that because far from the area of history I feel comfortable talking about. Why did mortality patterns change, and why did life expectancy kind of increase? So historians have posited a number of factors. So vaccination, for example, for smallpox was obviously a big contributing factor. Improved diet due to rising wages, trade liberalisation, etc. So the cost of living and wage rises in this period, like the cost of living didn't increase very dramatically in the from around the 1870s onwards. And I talk about trade liberalisation here because if you think about the British Empire, it's constantly, digesting these countries into its orbit. That obviously leads to a massive larder of food available for people. So what we actually see in this period, we see the working class diet diversifying, and that is obviously nutrition. It's obviously plays a very big role in sort of protecting an individual's health. Enhanced access to free medical care in the form of, for example, workhouse infirmaries, that probably also played a role. Greater investment in hygienic infrastructure, so sewers, the water supply, also housing as well, like slum clearance schemes obviously contributed to this kind of period of demographic change. And then with regards to why mortality patterns changed, we again, as I said, as life expectancy increases, what we see is an increase of degenerative and chronic diseases that people die from. Okay, so now I'm going to look a bit at health at home and in the workplace. Pardon me. I'm not unwell. I just my drink went down the wrong way. So as I said at the start, just because I'm covering health at home and in the workplace this week doesn't mean that it's going to be absent from the other weeks. I'm just, again, trying to think about the life cycle of the family and sort of introducing you guys to some of the changes that are happening in occupational health at this time. So in poorer households, the loss of one income would have had ramifications for all of them. It was like a ripple effect. And in the absence of the kind of robust welfare state we have now, even though obviously there was a degree of welfare organised by the state in the form of the poor law unions, there were options that working class families turned to for trying to plug that gap for when someone either became too unwell to work or died. So this here on the far left, this beautiful banner, is a banner from the Manchester Society of Odd Fellows, which was one of the biggest friendly societies in this period. So essentially you paid a small amount in to this society, and it provided benefit to you if you became too unwell to work, or it paid for your treatment, and also provided sustenance to your family, for example, if you became unwell. And as I'm going to talk about in a few slides and in a lunchtime lecture, I'm going to be talking about friendly societies in the post office. And there are other things as well that families could do. So this is a ticket for a pawn shop. So that this it was very common to pawn your goods and then kind of get them back when you could, when times were a bit easier, for example. homework or housework. This shows East London family in the opening decade of the 20th century making matchboxes. This was piecework, so you got paid for every item you did. And this was obviously quite a family-friendly way of working, I should say. As you see, all the children can be involved as well. This is the Salvation Army headquarters, I think, in Old Street in London. So obviously there were a number of charities in this period that you could apply to for relief. Often they were quite punitive, though, so they weren't necessarily all benevolent institutions. You know, they could be quite moralizing places. But the Victorians were very, very enthusiastic philanthropists, regardless, and you know, and people did turn to charity for help. And I included this here simply because in this advert for a border, simply because when I've been doing research on postal pensioners, I have found that some of them, after retiring, sort of to plug what I imagine is an income gap, is they do take on borders, you know, in after they retire. But obviously for that you need like room for a border, so I'm not sure how many it would have applied to, but you know, it was an option if you had the space. And I want to use this example to sort of illustrate how ill health could really affect the life cycle of the family. So Charles Booth here, he was a sort of proto-social scientist who was interested in poverty in this period. He concentrated on London. There were a number of people like him in this period. So Joseph Rowntree, for example, did interesting work in York. Kay Shuttleworth in Manchester. And what he did is he went to the borough of Stepney and interviewed everyone who was seeking relief from the poor law. And he categorized the reasons behind poverty, the reasons why these people were in poverty. And Rebecca Dobson, like many of the people in his casebooks, the cause, he ultimately decides that the cause of her having to claim relief is ill health. And so I've just sort of picked out relevant bits of her life story here. So you can see here, she has a very large family, a large number of children, and regularly, quite regularly gave birth. I mean, you know, there's obviously health impacts for that. But here I've just picked out certain points in her story which sort of just show how, you know, the lack of available postnatal care, you know, her husband, who was a jobbing bricklayer, so, you know, was essentially self-employed, was out of work unwell for 3 weeks, so they needed to apply for money for medical attendance. And then her husband has another accident and is unable to work, and her son falls ill and in hospital again. So this in this narrative, she's constantly having to claim medical relief from the poor law for various reasons, you know, and so much of that is due to the lack of protection that her husband had at his job. But a number of people did have a degree of workplace protection in this period, probably not people like Rebecca's husband. But what we do see in this period is we do see a greater recognition of the relationship between occupation and ill health. So anthrax and wool sorting is a particular one. So people who work with sheepskin and leather, for example, would inhale anthrax spores. And there was a big case about this in Bradford in the 1880s. Mining and silicosis. So in coal mining, silica dust is a byproduct, and you inhale it and you eventually develop this respiratory condition called silicosis, which lots of people initially thought was TB. And it wasn't just these kind of infectious diseases or these chronic respiratory conditions, as well as also lots of stuff to do with mental health. So this idea that teachers were suffering from chronic nervous exhaustion was another thing. There was some degree of statutory protection. So in the 1880, Employers' Liability Act provided, in theory, space for employees to claim from their employers if they were had become disabled as a result of their work. But they had to prove that their injury was the direct result of managerial negligence. So there were lots of, so for example, if you had a subcontractor on a job, so someone who wasn't your employer, and they were responsible for you having an accident, for example, you then couldn't claim because that wasn't your employer. So it was a kind of relatively complex piece of legislation that was ultimately a lot of the time designed to protect the employer. But then we get the Workmen's Compensation Acts in 1897 and 1906. The 1897 Act kind of firmly enshrined the idea that employers had statutory responsibility for their workers, and the workers now didn't have to then prove that their disability was the result of direct managerial negligence. It just had to have happened on the job site. And then in 1906, what happens is they add some industrial diseases like anthrax and lead poisoning to the list of things that people can kind of claim for. But over time, more and more conditions are added to this. So, for example, silicosis is added. And then there's debate as well about whether to add TB to it as well. But workers' bodies often still came under close medical scrutiny, and cases often went to court, and the amount you got was only around 50% of what you would have earned. So again, people have had to have looked for ways to plug that kind of income gap. Okay, so now a little diversion into workplace health in the post office. So postal work employees probably had a much better time of things than people like Rebecca Dobson's bricklayer husband. So there were a lot of medical officers of health who provided treatment for postal employees for most conditions. They didn't necessarily provide treatment. They didn't provide treatment for tuberculosis, for example. And they also inspected potential employees, and the employees had to pass medical exams to enter the service, and they also had to then pass regular medical exams as they worked as well. But despite this infrastructure, things weren't all roses. So from the 1880s onwards, we see a growing unionization of the post office. A lot of this is centered in London because 1880s in London, we're seeing a great ferment of ideas related to of socialist ideas. We're seeing like the Fabian movement, and we're seeing the anarchist movement in the East End, for example. And as part of this, many workers did come together to complain directly to the post office management about their working conditions and what they saw as having a detrimental effect on their health. Just to say, I felt the need to qualify this. They weren't. This was a concern that was perhaps a subsidiary or secondary concern to what they saw as maybe more pressing issues about pay and promotions in the post office. So whilst there was a lot of activity and a lot of complaints about the sanitary conditions of the post office, and about the effects of long hours on people's health, this wasn't their central concern. But obviously, it was related to more generally dissatisfaction about working conditions. Workers also participated in mutual aid schemes like the Civil Service Benevolent Fund in 1886 and the Post Office Sanatorium Society, which was established around 1895 and opened its own sanatorium in 1906. I spent a lot of time with the Post Office Sanatorium Society. They grow to be a very, very huge organisation, but I'll be giving a bit of a talk about them later. And just to say as well that the post office provided compensation to widows and children of those who have been killed in the service. These were often not a lot. It wasn't a lot of money, and it was only to the age of 15. But it was there. There was that sort of degree of protection for workers' families. So for part 3, I'm going to be looking at resources and tasks for this week. So for your first task, I'd like you to explore the main causes of death in this period. So look at how old your pensioner was and when they died, and what they died from, using either the worksheet or your life story form. And then if you click on the links, these will be in the syllabus, the following spreadsheets, which record the principal causes of death in 1901, actually, that should say as well, 1915, 1925, 1935, and this is in England, Scotland, and Ireland. Unfortunately, just because of the way the data is, there's not the same coverage for everyone. We've tried our best, but for example, in the case of Northern Ireland in particular, after in 1925 and 1935, for example, we only have the top 5 causes of death rather than the top 10. But I think there is a good breadth there, And then I want you to look at this and think about, okay, so how typical a cause of death was your pensioner's death? Kind of just get a kind of more general idea of what people in their age bracket were dying from, considering all the stuff we've talked about this week. And for the task 2, I'd like you to think about local histories of sickness. So I want you to go from like the big picture stuff to thinking more on the local scale. So to do this, I'd like you to watch a tutorial on exploring medical officer of health reports on the Medical Heritage Library. Then you go to the special section for these reports on the Medical Heritage Library. And if you can find reports from where your pensioner lived, I want you to read the reports to gain a sense of things like the size of the local population and its makeup, the endemic and epidemic infectious diseases that affected the community, the state of housing, etc. And as always, these tasks are just ideas. You can please feel free to go down research rabbit holes and explore further. That's absolutely great. These are just ideas to get you started. Okay, so on that note, I think I'll end the recording here. I hope you've all enjoyed this lecture, and I'm looking forward to discussing this with you in our discussion groups.